My cancer story started in 2012 when I was diagnosed with invasive vascular ductal carcinoma. It had not been my oncologist or my primary, but it had been an infectious disease doctor looking for something. And so I went back to the oncologist at home and said, I need to get on treatment. I need chemotherapy. I want to kick it again. And they told me, stage 4, we don't give you chemotherapy, but you have about 3 months to live, and we'll give you pain medicine. We'll give you pain pills. And I went home, and that just wasn't what I wanted. And so 3 nights in a row, I saw the ad for Cancer Treatment Centers of America. And I called, and it brought me here.
Elizabeth came to Cancer Treatment Centers of America for treatment of her primary cancer. After it spread to her surrounding bones, specifically to the spine, Elizabeth was recommended the Osteocool RF ablation procedure to treat her cancer pain.
I think what made Elizabeth probably the best candidate was her mindset to start with. She wasn't somebody that wanted to just sit around and hope things got better without her having to take part in it. And a lot of times we had to kind of struggle to rein her in so she was being reasonable with how much she was doing afterwards. And so that was probably the most difficult task, is telling her to listen to her body and be reasonable. But I think anybody that is interested in getting up and moving around and being active after the procedure is generally going to do better with Osteocool.
Elizabeth had 2 Osteocool procedures, the first treating L4 and L5, and the second about a month later, treating T5. Both of these spinal ablation procedures were followed by the balloon kyphoplasty procedure.
Well, I was on the fentanyl patch and oxycodone tablets for breakthrough. And so my breakthrough pain for my back was none afterwards. And I think we kept my patch at about the same because I have cancer in other bones, other parts of my body. But for that area, I did not have that, and I didn't have to take breakthrough pain for any of that.
Yeah, I think that was the tricky part when it comes to cancer, is it's not just focusing on one area. And so we couldn't necessarily take her off of pain medicine because we did the Osteocool, but a lot of what she was taking the as-neededs for was for her back, and she didn't really feel it was making much of a difference. So to keep taking those medicines without benefit isn't necessarily the best situation to be in. So at least we were able to get her off of the constant throughout the day, taking a pill when it wasn't really even helping in the first place.
My pain before I did the kyphoplasty and Osteocool the first time was probably a good 8 to 9 out of 10 when I walked in to see the doctor. Following Osteocool, you know, now my pain level is back to something I can handle, probably like a 2 to 3 out of 10 for the lower back. And even the upper back now. That one has taken a little bit longer, but it is much better, and I can get up and do stuff with my arms that I couldn't do before. I think I was just happy that there was an alternative and that it would be so easy. I really did not think it could be that easy and it would be that quick.
Yeah, I think a lot of times when patients are kind of on that slippery slope where they're doing more medicines and they're not making progress, it gets a little bit maybe frustrating, but also a little bit scary because you're wondering, is this what I'm stuck with? And so when there is a situation like you where we could use the Osteocool and kind of level things off or maybe even make things a little bit better, it's great to have that opportunity.
It is, because, you know, when you start thinking of pain, that's pretty rough. That affects all of you, not just the spot where it's the most painful.
I've actually found the benefits from a pain management standpoint to be far superior than just doing kyphoplasty. I've had patients have pain relief much sooner than they would have just treating with putting the cement in to keep things stable. And that OsteoCool benefit has been probably the biggest leap in pain management for these types of procedures that I've come across. The important thing to know is that radiation, chemotherapy, surgery, those are cancer treatments. What OsteoCool is providing is pain relief in the process of killing cancer cells. So we don't want to ever put the cancer treatment behind the pain management. But the important thing is if you can give somebody the pain relief from this procedure, it allows them to get the radiation, to get the chemotherapy they need to work towards that cure. But there's two different pains to think about. There's the pain that brought you in the first place to have this procedure, and then there's the pain that happens from the procedure itself. My expectations for patients is within a day or so, the original pain that brought you in the first place tends to go away. The pain that usually is there after the procedure is from the procedure itself. And just like any surgical procedure, after a couple days, the pain continues to improve and improve.
Since the filming of this video, Elizabeth has had a third OsteoCool procedure treating T11 in her spine.